Hey guys, what's up? I'm Junior and welcome to my channel. So today's video is like a continuation from where we stopped in relation to gross anatomy. So in other words, today is all about lower limb. But before going further, I just want to make or highlight some key points. So basically in anatomy, we have three branches or more or less aspects in anatomy for both first and second year medicine. We have the gross anatomical aspect. So this is like the aspect we have been doing throughout, which for first year consists of the upper limb, lower limb, and thoracic anatomy. Then you also have developmental anatomy and microscopic anatomy. So in future videos, or more or less subsequently, I'll be making videos in relation to this aspect. But for now, let's focus on gross, mostly lower limb. And before you all know the culture, click on the subscribe button, like, comment, share, and turn on the bell notification. Let's dive in. Okay guys, so welcome back. Today's video is all about the lower limb. So just as how the upper limb is formed as a result of regions, that's the same as the lower limb. The lower limb is formed as a result of regions like the gluteal region, you have the thigh, the leg, and the foot. So for each region, you need to know the osteological components of the region, the musculature, and the neurovascular structure. So now we are going to start with the gluteal region. So the gluteal region basically is present at the posterior aspect or the back of the pelvis. Now there is some kind of confusion between the pelvic bone and the pelvis. So the pelvic bone is more or less the hip bone formed as a result of the combination of the ilium, ischium, and the pubis. So the ilium is mostly at the superior, the ischium at the posterior, and the pubis or the pubic bone at the anterior aspect. So know the features of this bone. And now the pelvis is different in a way. The pelvis is a combination of the two hip bone or the pelvic bone plus the sacrum and the coccyx. So it is very important for you to know this bone, because if you are learning about the muscles at the level of the gluteal region, you need to have some basic concepts about the osteology. So now for the muscles, you have two groups of muscles. You have the superficial and the deep. So for the superficial, you need to know these muscles like the gluteus maximus, the medius, the minimus, and the tensor fasciae lata. So these are the muscles at the superficial aspect. That's the surface, very close to the skin. Then you also have the deep muscles like the piriformis muscle, obturator internus, quadratus, femoris muscle. You have the superior and inferior gemelli muscles. So you need to know all of these muscles, their origin, insertion, and the action. So now in relation to the arteries, as I'll be saying initially, most of these arteries are like continuation of the same artery. So the name differs based on the location. So for example, in relation to the arch of the aorta, it is the same arch of the aorta that extends downward to supply the whole of the lower limb. So the name differs based on the position. So the arch of the aorta extends to form the descending thoracic and abdominal aorta. But now, at the level of the fourth lumbar spine, that descending abdominal aorta bifurcates or divides to form the two common iliac arteries, that's the right and the left. Now, this common iliac artery gives us two branches. You have the internal and the external iliac artery. So the internal gives off three branches. You have the superior gluteal artery, inferior gluteal artery, and the obturator. So it is this superior and inferior gluteal arteries that supplies the muscles and other structures at the gluteal region. Then you have the obturator artery, which passes through the obturator foramen and supplies the adductor muscles at the medial compartment of the thigh. Then you have the external iliac artery, which continues downwards or inferiorly, and once it reaches at the level of the thigh, it is no longer the external iliac artery but the femoral artery. Now, why for the upper and the lower limb videos, like I've not been saying anything about the veins. The veins are just like your vena comitatis. So most of the veins are like accompanying veins. So that's what vena comitatis means, okay? Meaning if the artery is moving in this direction, then the veins are moving in the opposite direction. So for example, if you have the femoral artery at the level of the femur, or more or less the thigh, then you have the femoral vein at the same level of the thigh, but it is moving in opposite direction in relation to the femoral artery. So common iliac artery have the common iliac vein, but they are moving in the opposite direction. Okay, you also have the internal and the external iliac vein. You have the superior and the inferior gluteal vein, obturator vein, and so The difference is they are moving in opposite direction. So from the vasculature, you also need to understand something about the nervous supply to these muscles around the gluteal region. So for example, most of the muscles at the superficial are either innervated by the inferior or the superior gluteal nerve, which are more or less either from the lumbar, the sacral plexus. For example, you have the gluteus maximus innervated by the inferior gluteal nerve. You have your other muscles like the gluteus medius, minimus, and the tensor fasciae lata innervated by the superior gluteal nerve, which are all from the lumbar plexus. So you need to understand all of these nerves that innervate these muscles. Then you also have the longest nerve in the human body, that's the sciatic nerve, okay, which is more or less emerging from a combination of both the sacral and the lumbar plexus, the lumbosacral plexus. You need to understand also the cause or the path of the sciatic nerve. But now, the sciatic nerve does not innervate any muscles at the gluteal region of the lower limb itself. And for the deep muscles, most of them are innervated based on the names. Okay, basically in anatomy, you have nerves that innervate only one muscle. So for example, you have the nerve that innervates only the subclavius muscle. So for those kind of nerve, you are just going to name the nerve in relation to the name of the muscle. So for example, the nerve that innervates the subclavius muscle is known as nerve to subclavius because it only innervates the subclavius. So that's the same as the deep muscles at the gluteal region. So for example, you have the piriformis muscle, the obturator internus. You have the nerve to piriformis because the nerve only innervates the piriformis muscle. They also have the nerve to obturator internus. You have the nerve to quadratus femoris, etc. So now, for every region, there must be clinical correlates. So in relation to the gluteal region, you have a lot of clinical correlates, but I'm going to highlight few of them. Now, in relation to the ileum, the iliac crest of the ileum is mostly used for bone marrow biopsy to diagnose certain conditions like anemia, leukemia, etc. So another clinical correlate of the gluteal region is in relation to the intramuscular injection. Intra meaning within the muscle. So now, but whenever you're giving this kind of injection at the level of the muscle, you have certain nerves which you need to take into consideration. So at the gluteal region, you have the longest nerve, which is the sciatic nerve. So you need to know the exact location at the gluteal region wherein you are going to perform that procedure. So now, for your IM or intramuscular injection, the most suitable aspect to perform that procedure is mostly at the outer lateral aspect. Now, whenever you want to perform the procedure, you need to divide the gluteal region into 4 aspects or 4 quadrants. Okay, so you have the upper lateral and the medial, then you have the lower lateral and the medial. So you need to divide into 4 quadrants. Then at the upper medial and lower medial, you mostly have the sciatic nerve. So that's not the most favorable position for you to perform the procedure. So you can mostly perform your IM at the outer lateral aspect wherein there is no sciatic nerve, so as to prevent the destruction of the nerve. So from the gluteal region, you need to understand something about the thigh, which is also another region that makes up the lower limb. But before understanding something about the thigh, you need to understand your hip joint, the joint between the acetabulum of the pelvic bone and that of the head of the femur. So basically, for the thigh, you need to understand the osteology of the thigh. So mostly the only one bone that is present at the level of the thigh, which is the femur. So understand everything about the femur in terms of the proximities, the upper and lower proximities, the shaft, more or less your features of the femur, the borders, the surfaces, etc. You need to understand everything about the osteology because that's the fundamental unit of understanding anything about the thigh. Now the thigh is divided into 3 compartments by the deep fascia known as the fascia lata present at the level of the thigh itself. So the 3 compartments are the anterior compartment, the medial and the posterior compartment. Now for each compartment, you need to know the muscles that make up that compartment, their origin, insertion, and the action. And also for each muscle, you need to know the nerve that innervates that muscle. So now let's start with the anterior compartment. So basically, the anterior compartment of the thigh consists of muscles that extends the leg at the level of the knee joint. They also have some that flexes the thigh at the level of the hip joint. So you need to know all of these muscles like the sartorius muscle, the iliopsoas, the combination of the iliacus and the psoas major muscle. They know the 4 quadriceps femoris muscles. They are very, very important. Their origin, insertion, and the action. So now for the innervation, all of the muscles at the anterior compartment of the thigh, they are all being innervated by the femoral nerve. Okay, so you need to know the cause or the pathway of the femoral nerve. Then in relation to the vasculature, they are all being supplied by the femoral artery, which is more or less like a continuation of the external iliac artery. In relation to the medial compartment of the thigh itself, you also need to know the muscles, which are also known as the adductor muscles, because they adduct the leg at the level of the knee joint. You need to understand these adductor muscles, their origin, insertion, and the action. You have the adductor longus, the brevis, because the tendon is short, adductor longus because the tendon of the muscle is long. Then you have the adductor magnus, you have the pectineus and the gracilis muscle. Now for the innervation for the adductor muscles, they are all being innervated by the obturator nerve. And in relation to the vasculature of the blood supply, they are all being supplied by the obturator artery. They are so called obturator because both the nerve and the artery passes through the obturator foramen of the pelvic bone. Okay, now for the posterior compartment of the thigh consists of more or less your hamstrings. They are muscles that flexes the leg at the level of the knee joints. So the hamstrings, you need to know their origin, insertion, and also the action in their innervation. The hamstrings are your bicep femoris muscle, which consists of the short and the long head. You have the semimembranosus and the semitendinosus. Now, in relation to the innervation for this muscle, the short head of the bicep femoris muscle, so it has both short and long head. Though it's the same muscle, but it has a short and a long head. So the short head is innervated by the common peroneal nerve, and the long head with other muscles are innervated by the tibial nerve. So you need to know this innervation. Now, for most of these nerves are either emerging from the sacral or the lumbar plexus, as I've said initially. So for example, the obturator nerve, the femoral nerve are all like branches or emerging from the lumbar plexus. Then you have the sciatic nerve from both the lumbar and the sacral plexus. So they are very, very important for you to understand. So basically, for the sciatic nerve, does not innervate any muscle either at the gluteal or the thigh region. Okay, so the sciatic nerve, once it reaches at the middle half of the thigh itself, it bifurcates or divides to form the tibial nerve and the common peroneal nerve. So it is those branches that more or less innervate muscles at the posterior compartment known as the hamstrings and other muscles at the level of the leg. And also for the thigh, there are also a lot of clinical correlates in relation to the thigh, but I will explain or enlighten you on few of these clinical correlates. So now, for the femur itself, there are hip deformities, which are more or less congenital conditions. So for the femur, you have what we call the coxa vara and the coxa valga. So these are like congenital conditions that occurs during gestational period as a result of teratogenic insults. So now for normal people, the angle between the neck and the shaft of the femur ranges from 120 to 135 degrees. So for coxa vara, now coxa means the hip or anything related to the femur or the hip. Okay, so in coxa vara, the angle is less than 120 degrees, meaning the neck is very close to the shaft, so the angle decreases or is less than 120. Wherein for the coxa valga, the angle is greater than 135 degrees. So this is one clinical correlate. Then also, we also have what we call the true and the apparent leg length. They are also very, very important because these are like procedures that can be used to like diagnose certain hip deformities. Okay, so now for the true leg length is measured from your ACEs, that's the anterior superior iliac spine, onto the medial malleolus of the tibia. Then you also have the apparent leg length from the umbilicus or the navel onto the medial malleolus of the tibia. So these are like procedures that are very, very important to like diagnose certain hip deformity. So from the thigh, you need to understand the knee joint, which is formed as a result of the femur and one of the medial bone at the level of the leg, which is the tibia. So basically, the knee joint is not formed as a result of the femur and that of the two leg bones. So meaning the fibula at the lateral aspect does not make any contribution in the formation of the knee joint. So in relation to the leg, which is a region between the knee joint and that of the ankle joint, you need to know the osteology of the leg itself. Okay, that's the bones at the of the leg, which are the tibia and the fibula. The tibia is most at the medial aspect, then you have the fibula at the lateral aspect. So know everything about the tibia and the fibula, both the upper and the lower proximity, and the shafts, their features, the borders and the surfaces, and more or less the side determination, clinical correlates, etc. So just as the thigh, which is divided into 3 compartments, the leg is divided into 4 compartments. That's the anterior, the lateral, and the superficial and the deep posterior compartment. And each compartment consists of muscles. So for these muscles at each compartment, know their origin, insertion, action, and innervation. So now, for the anterior compartment consists of muscles known as the extensor muscles, which more or less extends the toe as well as dorsiflex the foot at the ankle joint. So to dorsiflex meaning you are like moving the foot away from the ground. So you are like flexing the foot at the ankle joint. So all of these muscles, or most, dorsiflex, they are in some extends the toe at the interphalangeal joint. So these muscles are like your extensor hallucis longus, the extensor digitorum longus, you have the tibialis anterior and the fibularis tertius. So now for the innervation in relation to the muscles at the anterior compartments of the leg, they are all being innervated by deep peroneal nerve, which is a branch of the common peroneal nerve. So in relation to the vasculature, meaning the blood supply to these muscles at the anterior compartment, they are all being vasculated by the anterior tibial artery, which is like a branch of the popliteal artery, just at the level of the popliteal fossa. Then from the anterior, you also have the lateral compartment, which more or less consists of 2 muscles, the fibularis longus and the fibularis brevis. So now for these muscles, know their origin, insertion, and the action. Okay, so now for the muscles at the lateral compartment, they are all being innervated by the superficial peroneal nerve, which is a branch of the common peroneal nerve, which is a branch of the sciatic nerve. Okay, so know the innervation. And in relation to the vasculature, now for the popliteal artery, bifurcate to produce the anterior and the posterior tibial artery. So it is the peroneal branch of the posterior tibial artery that supplies the muscles at the lateral compartment of the leg itself. So the peroneal branch. So now for the posterior compartment, you have the superficial and the deep posterior compartment, because you have 2 groups of muscles at the posterior aspect of the leg. So you have those that are the surface and those that are deep, so the superficial muscles. So now for the superficial posterior compartment consists of your calf muscles, which plantar flex the foot at the ankle joint. So for example, you have the gastrocnemius, you have the soleus, and the plantaris muscle. They are the muscles that located at the superficial aspect or the surface, very, very close to the skin. Okay, now plantar flexion is like the opposite of dorsiflexion. So to plantar flex meaning you are like moving the foot towards the ground or planting the foot against the ground. Okay, so you need to know the origin, action, and the insertion of these muscles. Then in relation to the innervation, they are all being innervated by the tibial nerve. And for the vasculature or the blood supply, it could be the popliteal artery or some other branches of the popliteal artery, like the posterior tibial artery. So from the superficial posterior compartment, you have the deep posterior compartment, which consists of more or less the muscles that flexes the digit at the interphalangeal joint. So they are known as the flexor muscles. So you need to know these muscles like the flexor hallucis longus, you have the flexor digitorum longus, you have the tibialis posterior, and the popliteus. Know their origin again, the insertion and the action. So now for the innervation, they are also being innervated by the tibial nerve, which is a branch of the sciatic nerve. So in relation to the vasculature, they are all being supplied by the posterior tibial artery, which is a branch of the popliteal artery. So guys, from the leg, you need to understand the ankle joint, which is more or less the joint between your 2 leg bones, that's the tibia and the fibula, plus one of the tarsal bone, which is known as the talus. So you need to understand the ankle joint and also the structures that stabilize the ankle joint. So from the ankle joint, you need to know your tarsus or the tarsal bones, which are your 7 bones. That's the talus, the calcaneus, the navicular bone, the 3 cuneiform bone. That's the medial, intermediate, and the lateral, plus the cuboid. Then from the ankle joint, you need to understand something about the foot. Okay, so the osteology of the foot, that's the bones that makes up the foot, like the metatarsals and the phalanges. Know the muscles around the foot, the vasculature, as well as the innervation or the nerves that innervate this muscle. So also in relation to the foot, you also need to know your different retinaculum, which is the plural form of retinaculum. So retinaculum is like a very thick or strong connective tissue that prevents tendons of muscles from bowing or moving out from their position. So basically, whenever a muscle is contracting, if this retinaculum is not on top or above the tendon, then the tendon at some point in time will move or bow out of its position. So it is very, very important for this retinaculum to overlie these tendons of the muscles. So now you have different retinacula at the level of the foot. You have your extensor retinacula, which is a combination of the superior and the inferior retinacula. So as the name implies, extensor retinaculum allows for the passage of tendons of the extensor muscles at the anterior compartments of the leg. You also have the peroneal retinacula, both the superior and inferior, at the lateral aspect of the foot. So they also allow for the passage of your peroneal longus and the peroneal brevis, mostly the tendons of these muscles that I've listed. Okay, the peroneus longus and the brevis. So it's more or less prevent them from bowing. Then you have the flexor retinaculum, which more or less forms the roof of the tarsal tunnel. So most of the tendons of your flexor muscles, so that's the reason why it's known as a flexor retinaculum, because most of the tendons of the flexor muscles passes through it in order for them to flex the toe at the interphalangeal joint or perform other actions. So it is very, very important for you to know this retinacula and wearing the span form and stuff like that. So guys, what you need to know is for any region, there are major landmarks that makes up that region, just as the upper limb. So in relation to the lower limb, you have these major landmarks which you also need to know. So you have landmarks like the femoral triangle, a triangular shaped depression at the anterior aspect of the upper 1/3 of the thigh, which is very, very important. To know its contents, the boundaries, you need to know the roof and the floor. You also need to know the popliteal fossa, which is a diamond-shaped depression at the posterior aspect between the lower aspect of the femur and the upper part of the tibia. So understand its boundaries, the contents, the roof and the floor. It is very, very important. You also need to understand the tarsal tunnel. Now the tarsal tunnel is somehow analogous to that of the carpal tunnel in relation to the upper limb. So for the tarsal tunnel, know the roof, the floor. You need to know the content of the tarsal tunnel in relation to your tibial nerve and the tendons of the flexor muscles. So more or less guys, these are like the major landmarks in relation to the lower limb. So guys, I guess this is almost everything you need to know about the lower limb. Okay, so in subsequent time I'll be releasing video in other aspects of anatomy, that's your microscopic anatomy and the developmental anatomy. And also guys, what you need to know is I'm not just limiting myself to just anatomy, because medicine is not just anatomy. Medicine is physiology, biochemistry, community medicine and other subjects in subsequent time. So I'll be making videos also for physiology and biochemistry. Okay, so just stay tuned. So thank you very much guys for watching this amazing video. As y'all know the culture, please click on the subscribe button, like, comment, share and turn on the bell notification. Guys, it's not really easy for me to make these videos out and publish them. Okay, so that's the only way you can support me out. Click on the subscribe button, like, comment, share and turn on the bell notification. See you guys in the next video.